If one's HbA1c and blood glucose are generally good, missing one dose will not cause much problems. But if one misses the dose frequently, it will lead on to serious complications, especially type 1 diabetic patients on insulin. If they miss the dose, they may go for diabetic ketoacidosis, which is a serious complication which may necessitate hospital admission and treatment. What one must do if a dose is missed? In general, if a dose is missed, don't get panic. Take the dose as soon as you remember. But if you remember close to the next dose, then skip the previous dose and take the next dose. Don't double the dose. Never double the dose. What to do if insulin injection is missed? There is not a set of rule for it. If a long-acting or basal insulin is missed, take it as soon as you remember if it is within 2 hours. If more than 3 hours has passed, check the blood glucose and if needed can go for fast-acting insulin after consulting your doctor. If short-acting or bolus insulin, which is supposed to be taken before your meals, is missed, take it as soon as you remember. If it is during a meal, if you remember during a meal, then take the dose after the meals. Within an hour of the missed dose, take the missed dose adjusted for the carbohydrate you ate. At the next meal time, if you remember at the next meal time, if the blood sugar is high, add a correction dose as per doctor's advice. So one must be very careful about the symptoms of hyper as well as the hypoglycemia. If you take the injection very late, you may go for hypoglycemia, which is dangerous because hyperglycemia is harmful. At the same time, hypoglycemia is dangerous. Then how to avoid missing medicines? That is planning of diet. You have to stick on to the planned diet. So you can take medications accordingly after meals or before meals, like that. Then fewer pills. Single pill combination could reduce the number of pills, and taking morning and evening doses also reduce missing. So you have to discuss it with your doctor. Then third person help. Friends and relatives may help to remind the medications. Cheaper pills, if price is a concern, discuss with your doctor about cheaper brands or cheaper medications because the new medicines are somewhat costlier. Then smartphone applications will help you remind about filling the pill box and taking the pills as well. So it is important to consult your doctor over phone if needed. During your visits to the doctor, tell him about the missed doses, which may avoid unnecessary changing of medications or increasing the dose of medicines. Thank you for watching.